Ciao mondo, hello world, hola mundo, hello mon, konnichiwa, ni hao, namaste. We are here in Rome at the Consensus Conference on Hemoabsorption Hemodialysis for chronic patients with Professor Lin from China. And we are privileged because Professor Lin has been used this technique in the last 30 years, right?
Yeah, right.
So what is your first impression about this conference, Professor?
So it's my great pleasure to be here to attend the consensus meeting. And I think this meeting gives me the most impression is innovation, and also I think can provide the hemodialysis patients are new modality of a therapy, and it can provide additional to clearance both the medium to large toxin, and I think it will help more patients in the world to get the high quality of life. And it has the very big significance for the patients.
So you have started this therapy many years ago. Now, what percent of patients in your center are doing this therapy?
It's nearby 98% of our patients receive the HA and HD or HA plus HDF.
So 98%?
Yeah.
Almost everybody?
Yeah, that's true.
Oh, so this is a unique experience, actually.
Yeah.
So we would like to ask you, in this conference, while we are trying to promote new studies, probably you have already the possibility to collect a large amount of data as a registry.
Yeah, that's right.
So people that are already in this therapy. Mm-hmm. But because you are going to have new people, you can probably also do a prospective study on a large population.
That's true. And I think the large amount of patients, the big sample patients, we enroll those patients to do the prospective study is very useful for us to spread or to tell the other doctors the experience or some side effects that doctors considered or worried. In fact, the HAHD is very safe therapy because it's also, we did it. We have done it for nearly 30 years.
So what were the problems you encountered at the beginning?
From the beginning, perhaps such as coagulation, we should pay attention. That is safety, no very big problem.
Not big problem.
Yeah.
Did you modify your anticoagulation strategy?
Yeah. For the beginning, for the initiation, because it depends the individual patient's state, such as a very low platelet count. Perhaps you need to pay attention for that and adjust the coagulation state, then give the patient HAHD.
And what are the main advantages you have seen now that you have a large experience with this therapy?
Not very severe side effects.
No side effects, okay.
No.
But what are the advantages? You mentioned to me the quality of life of patients.
Yeah. And such as the severe hypertension for the inching, such as restless leg.
Muscular strength.
That's right. For the sleep, because the frequency in China or in our center is just once a week. So this frequency, I think, is suitable. And we do the HAHD, we just combine these two techniques for 2 hours, and the blood steam speed is also just 200. Because we think that the more slower blood speed, the less absorption. So we decrease the speed of blood stream and then get a more absorption effect.
Probably in Western world, we are going to standardize the therapy to 4 hours
4
because
hours.
it will be easier for nurses to have the treatment standardized. And it will be interesting to compare the results.
Yeah, that's true. Honestly, to say, it's not add the additional workload for nurses because after 2 hours HAHDF, we use a special tube to connect the two devices. We just clap it, not need to remove it. So get off together for the 4 hours. The benefits for this method, I think, is we can decrease the anticoagulation doses. It decreases the doses of anticoagulation, so it's more safety for those have a higher bleeding risk patients.
So this will be something that we have to probably discuss in light of the Western approach, and we will compare the results. But it's very important to achieve information from people like Professor Lin, who has used the technique for now 3 decades. That's very important. So thank you very much for joining today Cappuccino in Rome. And thank you for the experience provided from China. Now, it seems that because you are Vice President of the Chinese Society of Nephrology, it is possible that the Chinese Society of Nephrology will stimulate a prospective study on this subject. And you have a large number of patients, so we are very curious to see the results of this study. Thank you very much.
Thank you very much.
The drink. Excellent.